Well, I really have to, Brunel, I believe that we had once had a embryologist with the last name Brunel from Colombia. I wonder if you're from Colombia. But at any rate, she was great. So that name kind of strikes a little bell with me. But PCOS, you need to understand PCOS better than that. So all that means is that you were born with too many eggs. And that sounds strange. I mean, it's good because you'll have a late menopause with all those eggs. But when you're young and want to have a baby, they'll inhibit secretion of FSH from your pituitary gland in the early part of your cycle. You're on day 4 now. And so you never really recruit a dominant follicle. And you either ovulate very late or you don't ovulate at all, and they're bad quality eggs and you don't get pregnant. Timing your cycle is not going to do any good. And going on drugs to try to stimulate ovulation won't do any good because it's hard to move that needle when you have so many eggs that they're inhibiting your pituitary gland. So what I recommend, the best way to handle PCOS is when you're not trying to get pregnant, go on birth control pills so you'll have regular cycles and you don't have that increased risk of uterine cancer with PCOS patients have when in their 50s and 60s. Go on birth control pills 21 days on and 7 days off, or the ring or any variety of that when you don't want to get pregnant. But when you do want to get pregnant, then I would recommend doing Mini-IVF because we'll get the embryos. We don't have to transfer them all at once. If you were stimulated enough without IVF to try to get ovulation with PCOS, you'll have too many eggs. You'll get hyperstimulation syndrome. You could have a dangerous multiple pregnancy. It's not safe to stimulate you enough to get ovulation if your problem is PCOS. It's safer to do Mini-IVF, and then you can transfer just 1 or 2 embryos at a time so you don't get a dangerous multiple pregnancy, and we can freeze the other embryos for later when you're older. So I think you're going about this all wrong. I think for your PCOS, we should put you on birth control pills now, cyclically, and when you want to get a baby, if you do want to have a baby now, we should do Mini-IVF.